Government's initiatives to stop the spread of the COVID-19 virus will cost the country billions of dollars. This was disclosed by Prime Minister Dr. Keith Rowley at a press conference Friday to update the nation on efforts to delay the spread of the virus.
The Minister of Finance committed a $6 billion program here on this response program in more ways than one. And so we were on the same page. The government has to find resources, and we found as much as we could. $6 billion is what we had not catered for.
And one critical commodity required in stopping the spread of COVID-19 is water. Prime Minister Rowley said, following complaints of people not having a water supply, he has instructed the heads of the regional corporations to invest in a truck-borne water supply for their burgesses in vulnerable communities.
To provide truck-borne water because they have not had financial wherewithal to do that. Now, I find that a little difficult, so I spoke to the and will keep speaking to the Minister of Local Government to instruct these people who are saying that to use monies that they have in their accounts to try and save lives.
Prime Minister Dr. Keith Rowley said at the meeting with the opposition leader, Kamla Persad-Bissessar, on a way forward for government's efforts as it pertains to the COVID-19 crisis was useful. Dr. Rowley and Mrs. Persad-Bissessar met at the Parliament this afternoon. He provided an update to members of the media following the post-cabinet media briefing.
We had a conversation. It was a very useful conversation. The opposition brought a printed list of what they thought the government should be considering, and they made certain suggestions. I'm pleased to say most of what they focused on.
Opposition leader Kamla Persad-Bissessar is calling for a more vigorous testing as a measure to delay the spread of the coronavirus or COVID-19. Mrs. Persad-Bissessar and the team met with Prime Minister Dr. Keith Rowley on Friday afternoon to put forward recommendations to assist in the fight against COVID-19. Mrs. Persad-Bissessar at a media conference said it is not good enough to test only persons with a travel history.
It is too restricted, and we could end up like a place like Italy and other places that did not vigorously pursue testing of, persons most exposed. Test, that's what the story is. We don't have enough. So yes, we have to limit them, but healthcare professionals should be somewhere really high up in the pecking order.
The opposition leader also has concerns about the limited testing capability of the Caribbean Public Health Agency, CARPHA.
We ask government in our document to consider the use of other labs apart from CARPHA who could be authorized, so therefore we could get the testing done on a wider basis, and that we could also have more personnel involved in the testing and in the assessing when you're taking the samples and doing the assessments.